This video is made possible by our loyal Patreon supporters. Visit patreon.com/psychetruth.
Hello, welcome. Today I'm going to be doing a full back massage for the lovely Lauren. Let's go ahead and get started. If you don't have time to watch this video right now, go ahead and save to your watch later and just watch whenever you get a chance. One of my favorite ways to begin a full back massage is with a simple stretch for the low back and just placing my other hand on the upper back, helping my client to ground into the table a little more. And always with back work, I do like to do some work in the glute medius to start. And this is more just a little stretch. I find it puts my clients a little more at ease if you kind of give them a roadmap of what you're going to be doing. And I'm just going to leave my hand here, move to the side of the table. I'm just going to be working on this right glute. And right now I'm just making sure I'm feeling around a little bit and making sure that I am not hitting any bony structures. And I like to incorporate just a little bit of shaking. It can feel soothing and is a nice way to start to offer a little bit more pressure. But just keep in mind, this is the beginning of the massage. You don't need to go too deep too fast. And just as like a, lead up to back work, sometimes I'll just spend a couple of minutes here. I won't use my elbow. Try and get more detailed than what I'm already doing. And I'm just going to land on these erector spinae, and I'm going to do some compressive holds, just walking my way up. And just pretend that I'm doing all this on both sides. Just for time's sake, I'm just going to do this right side. So the forearm is like a perfect tool for working on the mid-back, especially for these compressive holds along those supportive muscles of the spine and the mid-back. And not really taking too much time today with the warm-up. I'm going to go ahead and grab my oil. And before I grab my oil, I like to move the hair so that I don't get oil on Lauren's hair. And I also like to just make any adjustments I need to so that I'm not fumbling around with Lauren's arms throughout the massage. So just making sure I can get into those lats without fumbling around. And opening up the traps a little bit. If I want my massage to be a little more effleurage focused and flowy, I'll use a little bit more oil, but I'm using a medium amount. And I honestly might have grabbed a little bit too much oil, but one option, if you make that mistake, you can just grab some with your forearms, even if you're not going to use your forearms. I'll usually keep a towel somewhere so that just in case I have it. A lot of effleurage strokes with this full back massage. I like to really slow it down. And just be a little bit careful as you get towards the sacrum, because it can get a little bony, especially on smaller framed women like Lauren. My favorite way to do these effleurage strokes for the mid back especially is just with that soft, relaxed fist. And Lauren's bikini is making it a little bit hard for me to do that full stroke that I would like to, but I like to end that stroke all the way into the hips. It's a little bit hard with what Lauren's wearing. And be really careful if you're working on someone who has a moderate or more pronounced curve in their spine. You just want to go extra slow because it's going to make it that much harder to not hit the vertebrae on these effleurage strokes. And you don't have to feel like you're gonna, do anything that's gonna harm your client. Like if you hit the spine for a second, it's gonna be a little uncomfortable, but your client's gonna be fine. And one thing you can do if you're new to massage, and it feels really good too, if you're working on someone who has scoliosis or spinal issues, you can just run your fingers along the spine. And this is really good for the connective tissue as well. This is a technique I use a lot. So you can just get a better idea of where that curve is and work on the connective tissue that is often forgot about and it gets really sticky. I like to stack my hands so that I have a little bit more pressure to offer. And my right hand has that support so it doesn't get tired. But you're just going to feel more confident if you know where that curve is, how big it is, especially if your client wants deeper work. So at this point, I am going to go ahead and start working on this right side just for filming purposes. It's a little bit easier. Like to slow it way down. I'm shortening those erector spinae muscles. I'm just pushing in towards the spine slightly. And again, I would really like to be able to bring the stroke all the way past that iliac crest, but it's hard with what Lauren is wearing. It's just a lot more satisfying and more of a relief to the low back if you can broaden that stroke. And don't forget about your right hand. Sometimes if you're really focused on the left hand, your client's wondering why you're just leaving that hand there. So just remember to incorporate both hands because you get that magical feeling of both hands. Your client gets that magical feeling rather. Working on these lats a little bit. And I'm going to go ahead and go in with my forearm. And just continuing that work in the lats. And again, I would want to bring that stroke all the way into that glute medius if I can. You of course want to be a little bit careful around that hip bone, that you're not making your client feel uncomfortable, but you do want to work on that thick connective tissue around that hip bone. Stretch all that out. This is a really great time efficient way to hit a bunch of really good spots. And just always picking techniques that go well together, that I can flow in and out of and not feel like I'm losing my flow. Focusing on this QL muscle and working my way, continuing to work my way around that hip bone into that connective tissue. Just walking my hands. You know, a larger man, for example, you would have probably twice the amount of, maybe not quite twice the amount of space, but you'd have a lot more room. You just have to be a little bit more careful when you're working on this area so that you don't hit that last floating rib or the hip bone. And sometimes you just have to think about it for a minute and think to yourself, okay, how can I keep working my way up the back in a way that's not going to feel awkward or weird? So just moving in and out of these different techniques and as graceful a way as you can manage. You also, you want to move these erector spinae away from the spine as well to just get more space in between them, whereas before I was shortening them. And of course you don't want to press on the spine, but you can just create a little bit more space just by dragging your hands, the heel of your hands. Some of the most healing work you're going to do is more subtle. It's not always about just pressing as hard as you can. And I'm going to just shorten them again and working my way up. And finally, I'm going to go ahead and work my way around the scapula. If you're having a hard time finding the trigger points, you can always just use your finger pads and kind of wrap your hands around to get a better sense of what's going on. It also feels really good for your client. And if nothing else, you can just grab hold with your thumb. I don't like using this technique here unless I have to just because you really tire out your thumb pretty quickly, but it usually feels amazing to your client. So on especially women that don't like deep tissue, but they want to feel something here, I'll usually use my thumb, just because in that case it's easier than trying to control my elbow. And using your elbow can feel just as good, if not better, if you're using a good technique. So after doing deeper work in the traps, I like to just work on that lat area a little bit more and calm it all down. I'm going to go ahead and pretend that I've done both sides, and I really like to end with some work around that iliac crest. I'm just bringing my finger pads around the hip bones, getting into that connective tissue a little bit more. And it can honestly feel amazing. It's obviously pretty invasive, but if you wrap your arms all the way around the hip bone to the front, it can feel really great as well. And it's really great for people that have more chronic hip issues. And you also want to incorporate some psoas work as well. Kind of going off on a tangent. And this usually feels really good. And to finish, I'm just gonna work on those lats from a different angle, bringing that into the upper back. A few strokes into the neck, and tie it all together in a way that feels really good. And that is all for today. Thank you for joining me today. I hope that you enjoyed today's video, and I look forward to seeing you next time.